Where are things with respect to a vaccine?
Well, SARS happened in 2003 and we don't have a SARS vaccine. MERS emerged in 2013 and we don't have a MERS vaccine. And these are close cousins to COVID-19. Certainly the emergence of COVID-19 has, upped the ante and has encouraged incentives, shall we say, in the pharmaceutical industry, which is loath to make anything that doesn't show high profit potential in rich countries. If the stars had aligned properly so that some sort of appropriate incentive exists for the pharmaceutical industry, and we had a SARS vaccine that had actually by now gone through some clinical trials, we would be able to come up with a COVID-19 vaccine very quickly because they are genetically very similar. And if one worked, the other probably would. But unfortunately, despite attempts by the World Economic Forum and a variety of other entities, the Wellcome Trust and so on, to try and incentivize the pursuit of both MERS and SARS vaccines and to find the right funding mechanisms to get the science rolling and to get the pharmaceutical industry rolling, we don't have vaccines for either one. So, the most optimistic forecasts I've seen say that we could have one within a year. And I don't understand what Kool-Aid somebody's drinking to say that. Because, there's not a candidate, product sitting on a shelf to go into clinical trials. Now, even if you went into clinical trials with the approval of the Chinese government, executed in China in the middle of Wuhan, in the middle of an epidemic, you're not going to have, and you're going to do a placebo-controlled trial in the middle of an epidemic. You're not going to have data and results that you can really turn around and say, this works or doesn't work. And this is the appropriate dosing, and this is the necessary adjuvant, and this is how it should be formulated. You won't have those results anytime for many months. And we're not even close. So I don't understand where this 1 year figure comes from. Maybe they mean in 1 year we'll know what, at least in theory, a vaccine should be, what it would be made from, and how it might be formulated. But we certainly won't be in clinical trials. So I'm not optimistic that we are going to get out of this crisis via a vaccine. Not in the near term, not in its current incarnation.